Don't judge me for how I look. Look how I look. And there's not a single thing I can do about it. My hair is wild. It's dreadlocks, and when you, in one way it's good, as in I don't have to brush them, but I also have to put them somewhere and do my hair, and I haven't been able to do that today. So I am, how many days? I've lost track. I think I'm about 7 or 8 days post open heart surgery, where they, regardless of the heart procedure you're having in an open heart surgery, it's kind of the same. I'm quivering. Sorry guys, I'm literally, my body just is in shock. And so I'm just, everything I do is like that. And I can see it on the camera, and that's what that is. So yeah, it's the same in that, and I watched the full procedure that I was having done before I had it done, so I know exactly what they did. They use an electric saw to cut your midline. They open your midline, and then they cut it with an electric saw down the center. And what they do is they put retractors in and pretty much just pry your chest open to gain access to your heart. What they also do is they deflate your lungs and they reroute your blood whilst you're having the procedure to keep your body alive whilst they're operating on your stopped heart. So regardless of the heart procedure you've had done, and mine is the result of a congenital heart defect that I was born with. It's called bicuspid aortic stenosis. What it means is the regular healthy heart has 3 little leaves on to make the valve that opens and closes to let the blood out of your heart through your aorta. So when you've got your 3 little valves, I can't do it because I'm just too shaky and my brain's not working. The blood comes out, the 3 valves open up, and it works, right? So when you've got bicuspid, 2 of those valves are stuck together. So what you get is they don't work, and the 1 little leaflet left does all of the work. And what usually happens is people get to my age and that little bit of a valve that's been carrying the load has started to fail. So it's common, I'm 49, and it's common for people of my age to discover that they had a heart defect they had no idea about. But regardless of the procedure, it's a brutal, the opening of your chest cavity and deflating your lungs and rerouting your blood and mixing it with fluid and anticoagulants. It's intense for your body to deal with, because what they do is then they fix your heart, they put it back in, they stitch your sternum together with wire. Mine's moving all the time. It's the most grossest feeling I've ever felt, and I don't know where and it's gonna adhere together. Hopefully it's not because I'm doing too much, and I am doing too much, which I'll talk about. But then what they do is they reinflate your lungs and they put all of that blood that they've taken and circulated with lots and lots of fluids, they put it back into your body and then they stitch you up, right? So regardless of the procedure, your body has to deal with that. And it is a fucking enormous shock to your system. I thought I was prepared. I have been through a house fire where I suffered severe airway burns. I was in a coma and in intensive care for weeks. the struggle was the suffering was so enormous that I thought that I was prepared for this open heart surgery. And it turns out I wasn't at all prepared. And this is very much like that, in the sense that you have tubes coming out of everywhere. You are literally stuck to your bed in agony. You can't move because you're just stuck to machines. And your body is in shock. I currently weigh 12 kilos more than I did when I walked in for heart surgery. Because when they pump all that fluid back into your body, in your blood, your body has to learn to deal with it. And it's a whole lot. And I'm young. So what I saw in the hospital, such suffering, and I've been through a week of such intense suffering. I'm very grateful that I am my age. I'm 49, which isn't young, but it's very young in the heart hospital. So many people are having procedures like mine, or triple bypass, or all different kinds of open heart surgery. And I just see them in their beds, and I see them trying to walk. And having this done when you are older is just a whole other, you know, I'm suffering and this is hard, but they're suffering for so much longer and it's so much harder. I'm so lucky I was able to just sort of get out of bed and walk, like I walked in there, whereas they're all on frames and just looking. It's so painful, and your body is in so much shock that it is just so hard on your body. And so I'm lucky I'm young and that my body's able to deal with it better than a lot of what I was seeing in the hospital. So I've come home, and you know, this recovery is just no joke. It is so fucking hard. My lungs feel like they've been deflated, and my chest feels like it's been reefed open, and my body feels like it's trying to deal with 12 kilos worth of fluid that is too much within my body. So when I wake up, it is just like screaming pain and burning lung pain. And I accidentally sneezed today and it fucking nearly killed me. Sorry about my swearing. I swear a lot. And it's just been so fucking hard. So hard. But I have the most amazing parents. They have just been doing everything. They just took me down to the chemist this morning to get some decent painkillers because I was in so much pain. And I've got a daughter and I'm a single mum, so we got some things for her and her friends staying over tonight, which is actually good. It means I can just veg in bed and sleep, and they're going to bring me dinner and all of that kind of thing. So it's not an easy recovery. It's not an easy process. It's a lot more than what I thought, but I'm also I'm 7 days out and I'm in my bedroom and I look like hell at the moment because I just can't deal with anything to do with that. But what people are saying is that I look a lot better in the sense that my heart's now working. So my body's in agony and shock, but my heart procedure worked and I had the Ross procedure. And with the Ross, you don't know if you're a candidate for it until they get in. They've got to literally cut you open, cut your heart, look at it to see if you're a fit for what they need to do, right? And the wonderful thing about the Ross procedure, it's a much more risky surgery. It's more complicated. It's only 2 surgeons in all of Melbourne that do it, but the outcome is vastly better in the sense that in 20 years' time, 98% of the people that had the procedure are doing well, alive, and have a normal life expectancy. Whereas if he couldn't do the Ross procedure, what he would have had to do is put a different valve in instead, either a cow valve or a heart valve, a pig valve, or a mechanical valve. And when you have those procedures, they only last for 10 years, if you're lucky, which means you need it done again, and you need it done again. And each time you get it done, it doesn't go as well because it's a highly operated area. You're a lot older. So the reason why I got the Ross procedure was because I am young. So we don't want that to happen. And if you do have the cow valve, the pig valve, the mechanical valve, in 20 years' time, 80% of the patients are alive, as opposed to the 98% for the Ross procedure. But you do have a shortened life expectancy. And how shortened that is just depends on your specific issue, your valve, and how you take care of your body afterwards, and all of the things. I'm so fortunate, right, in that I was worried. I went you have to have an angiogram before you have the procedure done to check your veins and arteries and see if they're blocked or have got, cholesterol buildup and all the things that can happen in an aging body, especially if you eat a lot of bad foods. Now, I don't eat a lot of bad foods, but I really rely on energy drinks just to keep me alive. Funny how now I'm finding out it's because I've been existing in heart failure. I completely forgot what I was saying. Hold on. I can't remember. It'll come back to me. Anyway, I just wanted to sort of check in and say how I'm going. It's tough to get a minute even just to sit down with the camera. I spend a lot of time in a lot of pain, and I'm talking the kind of pain that has you like as though you're going through labour. You have to, it's intense, and you have to kind of ride it out and breathe. And I am so grateful my surgery has been a success. I did not want to do this again. And to anybody that is about to have it, that's what I was saying before. I'm lucky because I did the angiogram and all of my arteries and veins are completely free from any kind of buildup of fat, cholesterol, calcium, all the things that can happen, which makes my long-term prognosis even better. If you're, for example, having a triple bypass, which is often heavily diet-related, and you don't make dietary changes afterwards, and often you've already got terribly constricted and difficult veins, your prognosis is just harder to recover from. But what I do want to say, hang on, I need a drink because I'm just so dehydrated, even though I've got 12 kilos of fluid in my body, which I'm taking diuretics for. So what I wanted to say was, actually before I say that, I had an aortic line. It was in my body for the whole time I was in hospital, or most of it, and it went down inside my body into my heart, and it means they can medicate your heart directly. But because it was such heavy weight and a terrible position, I've got the biggest lump, and it is so sore on the side of my neck. and it's just a hematoma and bruising from the trauma of having that thing in. So I've got that, I've got this, and I've got some medications that I need to take, and it's hard. My advice is do not try and skip on pain relief. You take every bit of pain relief, ask for more, and make sure you are medicated properly. That is the primary issue I've had in so many places, actually. I do not like, I've just had my chest cranked open. I don't need you to wake me up and see how I'm feeling pain-wise in order to treat my pain. Once pain, and I'm a nurse, I'm a vet nurse, once pain is happening and it's bad, it is so hard to get on top of. Whereas if you give preemptive pain relief, your body does not get to that stage. Now, my heart rate, I'm not kidding, I did not know that this was even possible, and it worries me enormously because I've just had heart valve surgery. You have to keep your heart rate low and you have to keep your blood pressure low, right? I woke up in so much screaming pain that my heart rate went up to 200 beats per minute. And I had nurses telling me to lay down and be still. And I have never yelled at nurses before, but I yelled at nurses. And I'll talk about that in another time. Please take the pain meds, because what they did then after that was they gave me a fentanyl button. So it's a fentanyl, I forget what other pain relief they mix it with. And you're in control of that. When you're in pain, you press the button, right? And you can press the button 1,000 times. You are not going to overdose because it only delivers your maximum dose anyway. So take all of the pain meds. Be prepared that for a week, it's going to be fucking hard. Your body will be in shock. You will be in pain. And each day you get better and better. And then you come home, and it's a long healing process. And so just expect that. If you expect that and you give yourself the space to do that, you will be okay. I don't know what I thought. I just had preconceived ideas of how it would go. I usually bounce back from surgeries very quickly. I have a really high pain tolerance. But man, this has just floored me. Absolutely floored me. And it will floor you too. And then you'll get better. So make sure you've prepared to do nothing. Like, have the space to just focus on your health when you get out of hospital for the next month. And focus on getting better. And you do get better. It's just a long road to getting better. So I just wanted to say that. And I'm about to watch the first episode of the newest Stranger Things. My daughter and her friend are in another room doing that as well. And then I'm going to go to sleep. And then the girls are going to cook spaghetti bolognese for dinner. So yay for having slightly older children now. Anyway, I think that's it. Bye.